Hi, I'm Dr. Teh Wee Min from Oasis Eye Specialist, and today I'd like to share an important topic regarding a common cause of poor vision in our diabetic patients, and that is diabetic macular edema. Diabetic macular edema is one of the main causes of poor vision in our diabetic patients. In Malaysia alone, diabetes is a big problem. 7 million Malaysians adults are likely to be affected by diabetes by 2025. An alarming trend that will continue to see the diabetic prevalence of about 31.8% of adults aged 18 years and above. Not surprisingly, the incidence of diabetic macular edema or DME is also expected to rise further. So what is DME? This condition is characterized by accumulation of fluids and thickening of the macula, the region in our eyes which is most important for our central vision. The fluids are a result of leaky blood vessels damaged by the effects of diabetes. Inflammation also contributes to the leakage and accumulation of fluids at the macula. DME can occur by itself or simultaneously with diabetic retinopathy, another visually threatening eye condition from complications of diabetes mellitus. What are the risk factors for DME? The duration of diabetes, poor glycemic control, hypertension, and renal impairment are among the risk factors for the development of DME. Thus, it is important to get your eyes checked when you have been diagnosed with diabetes mellitus and to make sure that all other concurrent systemic illnesses are managed optimally. What are the symptoms of diabetic macular edema? Because the earlier stages of DME are usually asymptomatic, many diabetic patients are often unaware they have developed such complications. The symptoms are somewhat dependent on the location of the edema within the macula. If the edema occurs outside the center of the macula, what we call the non-center involved DME, patients may not even notice any changes in their vision. However, if the edema occurs or spreads to the central area of the macula, patients generally experience progressive vision loss that occurs anywhere from weeks to months after the initial symptoms. A comprehensive eye examination should include checking of visual acuity, intraocular pressure measurement, and a dilated eye examination. An optical coherence tomography, or OCT in short, is now routinely performed to quantitatively measure the central macular thickness as well as to qualitatively assess the changes in the structures of the macula. The OCT scans are usually repeated from time to time to monitor the condition as well as to gauge the treatment response. So how do you treat DME? The need for treatment depends on the severity as well as the location of the edema. Select cases may be managed conservatively with careful monitoring over a series of follow-ups. More severe DME that is visually threatening need early treatment. Traditionally, slit lamp laser therapy was the gold standard for treatment of DME. However, it has now been largely replaced by intravitreal injection of antivascular endothelial growth factor or Antivirgif agents. If your doctor has advised for Antivirgif injections, do bear in mind that treatment is usually over a prolonged period of time to achieve optimal results. The injections are usually initiated monthly for the first 3 months, which is called the loading phase, followed by further injections or what we call the maintenance phase, depending on the improvements seen. However, in contrast to intravitreal Antivirgif injections in other eye conditions, such as age-related macular degeneration or AMD, studies have shown that the number of injections needed gradually decreases after the first year for DME. It is also especially important to optimize the other systemic comorbidities to ensure best outcome for your DME treatment. Intravitreal injections of Antivirgif must go hand in hand with better control of your diabetes and other medical conditions. This will ensure the optimal outcome for your eye and to reduce the risk of recurrence. Thank you.